Today's date is February the 28th, 1994. I'm Blake Hailey, and we're pleased to have with us Mr. Dan Jensen, the Associate Vice President for Governmental Affairs. We are making this video in the Biomed Communications Department of the Gibson D. Lewis Library at the University of North Texas Health Science Center at Fort Worth. Mr. Jensen, thanks for taking some time out of your busy schedule to meet with us this morning.
You're welcome, Blake.
I'd like, if we could, to start back in time and go back to a little bit of your prior background and what brought you to what was then TCOM or the UNT Health Science Center, however you want to look at it.
Well, you can start, I guess, when I finished college. I went to work in governmental affairs. I did some campaign work and moved to Washington, worked on a congressional staff, and left from there to run a campaign for the state senate, and was fortunate to have a state senator elected out of Houston, and I moved to Austin to work on his campaign doing legislative issues. And one of the groups that supported us in our campaign was the Texas Osteopathic Medical Association. And that was the time that in 1981 there was a major battle between the Texas Medical Association and the Texas Osteopathic Medical Association on the board makeup for the Board of Medical Examiners. And it was a battle as to whether the osteopathic physicians in Texas would continue to have 3 DOs on the board and 9 MDs. The MDs wanted just 12 physicians, and TOMA knew that they couldn't politically have those appointed without a statutory requirement. And fortunately, I worked for the one Republican state senator who supported the DOs in that time. And because of that, I made some good friendships with the Osteopathic Medical Association physicians that were down there. And after that session had ended, they offered me a job to come to the association, of which I worked through one session there, and then Ralph Willard and Mike Ford at that time hired me to come over and be Director of Development here, knowing that my main job would be in Austin, trying to help free up some more state dollars.
So about what year was this that you came?
I guess I came in about 84 to 85.
Oh, okay. So you've been here quite a long time.
I've been here a long time. I've lasted longer than I thought.
Now, if we could you track some of the legislative process that you helped to bring along for the UNT Health Science Center? I guess this all started in, what, about 1991 or maybe a little earlier?
Well, you know, the main job that I've always had, there are lots of issues that affect a health science center and any state institution in Austin. Unfortunately, most of the people don't care about most of those issues. What they care about is the amount of general revenue that's brought back in to pay raises and add additional help. So that has been a major effort of this institution, was to help our budget in the process over the last however long I've been here, 8 to 10 years. Because of that, and because we've been successful thanks to a lot of strong members in the Tarrant County Legislative Delegation, they have continued to allow the Texas College of Osteopathic Medicine to grow and prosper over the last few years, which allowed us to add enough physicians and enough basic science faculty that we could sell them on the need to make us a health science center with some additional programs besides just the medical school itself.
What types of programs do you see adding?
Well, I think right now for us the sky's the limit. I hope that I think the legislature has been very, very pleased with the fact that when back in the early 70s, when Gib Lewis and Betty Ann Duhar and a lot of Tarrant County legislators went to bat to make this a state school, they promised that we would turn out primary care physicians, we'd turn out physicians that went to areas of need, and we've done that. We have that has been one thing that we have continued to do, and I believe that probably in any growth in the Health Science Center, I'm hopeful that it continues in that pattern towards primary care or patient care and things that help the underserved areas of Texas, which has been the strength of this college and now the Health Science Center.
Now this Health Science Center can only give out the DO degree and will never be able to give out an MD degree. I know that's been a concern of a lot of DOs.
That was, in fact, we put that in the bill to answer a question that one of the state senators raised. The issue of becoming a health science center was never an issue of trying to lose the osteopathic heritage. It had absolutely nothing to do with that. In fact, when the bill was drafted to make us a health science center, we continued to make sure that the strengths that had gone into the Texas College of Osteopathic Medicine statute remained in the Health Science Center statute. That is, that the president of the Health Science Center will be a DO, so that will always allow the osteopathic philosophy to continue from the very top. No matter what happens as we grant the DO degree, we're accredited by the American Osteopathic Association. They don't accredit MD degree requirements. And one of the questions that was raised was whether we were trying to be an MD institution, and I said that is absolutely not the case. And one of the senators asked, it said, well, maybe we ought to put in the statute the degree programs you want, so that he knew we weren't going to try to put an MD program in. And I felt that it would be disadvantageous to this institution for us to try to put down that we, in statutory language, we want a PhD in biochemistry, we want a PhD in anatomy, and then find out that somewhere that biochemistry, we really want a PhD in molecular biology, and then we'd have to go to the legislature and change it, versus the process that all other institutions go through, which is to go to the coordinating board and ask them to approve your degree programs. So I said, well, what if we just put down we cannot offer an MD degree? And that was acceptable to him, acceptable to our Board of Regents that were there at that time, the Chancellor, the President, and pretty well clarified that the intent of making us a health science center was not to change the osteopathic heritage of this institution.
To get the final bill passed, were there any major changes that y'all had to make that you didn't start out with originally?
Yeah, originally what, and it really amazed me as well as a lot of the legislators, excuse me, it seems so simple to me to say that you could pass a one-paragraph bill that said, wherever it says the Texas College of Osteopathic Medicine now is the University of North Texas Health Science Center at Fort Worth. Instead, what we got was about a 25-page bill that took every statute that listed the institution and changed it to the University of North Texas. So a lot of people were looking at language that was already in the statutes and wondering why we were putting it in there. The first thing that we did ask, we went through a special session when Gib Lewis, who was the sponsor of our original bill, while it was in his last term as Speaker, he'd announced he was leaving. We were in a special session. The special session was over public education, and in Texas, unless you're on the governor's call for a special session, one person, one House member or one senator can raise a point of order against further consideration of the bill since you're not on the governor's call. We were willing to risk that. If you say a risk, we were willing to go forward and try to change the name of this institution to allow Gib Lewis to be the sponsor of that, since he had basically been the sponsor of the first bill and had watched over us during his entire time in Austin when he was a member of the House of Representatives and during his 5 terms as Speaker. He agreed to do that and said if we were going to change the name of this institution, he'd like to do that. And we took it forward, and we had no opposition in the in any of the committee hearings, no opposition in the House. The Speaker passed it in record time. In fact, when it got to the floor, he passed it. There wasn't any discussion. He then adjourned the House for 5 minutes, so it would be, quote unquote, a new legislative day, and then passed it on 3rd reading. We were out of the House in record time. And we went to the Senate, had a meeting of the Senate Education Committee, and there was no opposition. Nobody signed up to testify against it or for it. As a matter of fact, we as a state institution can only testify on a bill, not for it or against it.
Mm-hmm.
And then we ran into a problem with a state senator from San Antonio, Senator Cryer, Cindy Cryer, who's now the county judge there, and she felt that this was not the proper time. She felt that we were trying to add a lot of new additional programs through this legislative intent, and that that would impact on the needs of South Texas in their need for a health science center or additional health care programs there. She was able to have the sponsor pull it down. It never came to a vote in the House, or never came to a vote in the Senate, because she said she was going to raise a point of order and kill the bill, which she had the right to do as under the governor's call. So when we came back to the regular session, we tried to change the language in the bill to assure everyone that we weren't creating new programs with this bill. We were not adding additional things by changing the name and the designation to a health science center. What in essence it allowed us to do was to put more in statute what we currently are, since we were already teaching a number of programs whose degrees were granted from North Texas but not from here, and would allow us to go to the coordinating board and have other programs approved by them and back to the legislature to have them funded like every other medical school or health science center has in Texas. So we changed a few words to clarify that, but the intent remained the same. One of the issues that upset some of the individuals is we took out the name Texas College of Osteopathic Medicine and we put in a College of Osteopathic Medicine. And that allowed for our caption on the bill to say, instead of creating a new institution, it was to changing the name thereof. So it answered some of the problems that we had in dealing with some of the South Texas members as to whether we were really trying to create a new institution here that many of them felt were needed in South Texas instead.
So Representative Cryer then voted for...
No, Senator Cryer had already been elected to the county as a county judge, and in fact 2 days after the special session where she killed our bill, she was sworn in as county judge and resigned from the Senate. But in all honesty, when we took it back to the legislature, in the House, there was no opposition in the House Higher Education Committee. When we went to the House floor on second reading and on usual days, other than when Gib Lewis pushed it through, you have to have a bill read on a day in the House, and then they adjourn and you come back the next day for final reading. On the second day, there was one House member, Sue Schechter from Houston, that went up and registered as a no vote for it. And interestingly enough, she's a graduate of the University of North Texas and whose family lives in Cleburne and had visited our Godly Clinic. So, but she felt that, my understanding is, she just felt that we could continue our mission better as the College of Osteopathic Medicine. But on third reading and final passage, she did not register a no vote, so we can say that we had unanimous support from the House of Representatives. We went, the Senate had, prior to that, we'd gone to the Education Committee. We'd ran into some problems with some South Texas senators. Senator Zaffarini from Laredo thought we were again trying to do things in North Texas when the needs were tremendous in South Texas. But in the final end, we passed it without any negative votes in the Senate Education Committee, and we passed it from the Senate with the vote of 29 to 0, and that's only because two senators, one of which was a graduate of North Texas who'd committed to help us, but two of them were gone that day, Senator Henderson and Senator Harris, both Republicans who had voiced their support for it previously. So we did pass it, and then it went to the governor's desk, and she signed it on June 6th, officially making us the University of North Texas Health Science Center.
So it sounds like it would have passed on the first go-round if Representative Cryer had not
that's exactly
raised the
right.
point of order.
Had not had she not raised the question said that she alone was going to kill it, and she had gone to a number of other senators trying to get them to stand with her. But they all felt that we weren't doing anything underhanded, and that it really didn't change the mission of the institution, but really put in statutory language some of the things we were already doing. She couldn't find anybody, so she stressed to the sponsor at that time, Senator Mike Moncrief, who then sponsored it in the regular session and passed it, that she was going to kill it. And it was right at the very end of the session. In fact, it was the last day that the Senate was in session for the public education bill, and he agreed to pull it down instead of having her voice her opposition to it.
Have they ever said in South Texas where the medical school would be if they put one there?
No, that's a major fight amongst the South Texas members. I'm not sure whether they're going to put a medical school there, as a matter of fact, but there is a question as to whether the state needs another medical school, and the House Committee on Appropriations that deals with higher education is starting their, at the end of this month, they have their first hearing in Harlingen concerning whether another medical school is needed in South Texas. There's been a lot of testimony about the fact that some states like California don't have a lot of medical schools, but they have a lot of residency programs. Mm-hmm. And because of the correlation of where you do your residency program is stronger for where you stay than where you do your medical school training, there is a question about whether it would be more beneficial to that community to, instead of establishing a medical school, perhaps establish a lot of residency programs mm-hmm. that allow students to train down there and then would stay to provide some of the health care needs. And there are tremendous health care needs in South Texas.
It's like we could saturate ourselves with medical schools and not residency
There
programs.
are some that think we already have. With 8 in Texas, we probably have more than any other state in the nation, 7 state schools and 1 private that receives a substantial amount of state dollars. Baylor College of Medicine mm-hmm. is private, but they get a lot of state dollars. And, well, there has been, ever since I've been here, a feeling amongst some of the legislators that perhaps we ought to close a medical school or two because we are expensive.
Well, hopefully then UNT won't be one of those up for consideration.
Well, the good thing is I'm in Austin, so I'll know first and get my resume out before everybody else up here.
Oh, you got the inside track?
That's it.
What were some of the things that you had to do, possibly drum up support in the community here, and even possibly, I mean, I know it sailed through nicely in Austin, but were there some other things you had to do to get support in Austin?
Yeah, I think probably one of the greatest things that, you know, it goes back even to Gib Lewis. Gib was a very popular speaker, and we were known as the Speakers Medical School. Because of that, our institution has friends that helped us that are not directly related to Tarrant County or this institution. For example, when the speaker was carrying the bill, the speaker didn't leave the podium, but one of his top lieutenants, if you can call him that, Hugo Berlanga, who's from Corpus Christi, state representative. He was chair of the calendars committee, which sets the calendars for all the bills that can come to the floor. A very, very powerful member, and has taken us under his wing as well. He's the one that laid out that bill on the House so that we would not receive any South Texas opposition. He's from Corpus, and thought that if he laid it out, the members from the South Texas area would understand it was a statewide issue and not a North Texas versus South Texas. In fact, that same thing happened this last time. Representative Bill Carter, who was the chairman of the Tarrant County Legislative Delegation and a Republican, passed the bill on second reading, but there were some questions about whether South Texas was concerned about it again. So Representative Berlanga, who was a co-author of the bill, as well as all the members of the Tarrant County delegation, except Representative Doyle Willis and Representative Kent Grusendorf. Those were the only 2 out of Tarrant County that did not sign on as co-authors, although they supported the bill. Representative Berlanga was a co-author, and he got up to pass it on third reading to make sure everyone knew that that was his support for it. And this last session, instead of being chair of calendars, Representative Berlanga was chair of the Public Health Committee, so he could at least talk about the needs for in the health area as the chairman of that committee, and was very beneficial to us.
So you had the South Texas connection then too that you
We
needed.
tried to have the South Texas connection because we knew that was going to be a problem.
And it sounds like most of the representatives here, you say, but two in this county were for it, so that you didn't have to...
Well, they were all for it. They were all for it. What happened, the Tarrant County delegation, in all the years I've been here, has always been supportive of our institution. I guess it started with Gibb and Charlie Evans and Mike Millsap back in the early 80s, late 70s. They were very, very supportive of our institution, and they've gone on to do other things. But the people that have taken their place have always been supportive, whether they've been Republicans or Democrats. Bob McFarland and Bob Glasgow were two state senators that both on the Finance Committee, both on the Legislative Budget Board, that always fought to make sure we were funded in an appropriate manner. And when Bob McFarland left, Senator Chris Harris came in. Senator Harris was, when he was a House member, following Bob McFarland into the House seat, he's the one that put in funding to establish our DNA lab here for almost, $750,000, of which now, because of we do 40% of the paternity testing statewide for the Attorney General's office, and it means a little over $125,000 a month into our practice plan that we generate because Chris Harris thought we ought to get into paternity testing and establish a DNA lab here. There's also spin-offs from that. Not only is it the financial aspect and the fact that we are helping the Attorney General with a tremendous state need, that is establishing the paternity so that fathers have to pay child support for their children, which takes a tremendous tax burden off the state of Texas. But we also, because we have that DNA, are working with bone marrow transplants with Cook's Children's Hospital for children, and some other hospitals in that same area with genetic testing that came directly out of some funds that went in for one reason, which was paternity testing, but ended up benefiting the community as a whole.
So we do have a lot of, we help the state out in a lot of different ways then, which makes us marketable for them.
I think that's right. I think the greatest thing that our institution has is the amount of our graduates that go into primary care, they go into family practice. We not only lead the state, we're 1, 2, or 3 in the nation, depending on which year it is, and that's what every member is pleased with that, because they all have areas that are desperately in need of primary care physicians. And then we tend to have some strength with a number of rural senators, because 31% of our graduates practice in towns less than 25,000. And we're putting them out in areas of need in Texas, and so they've been supportive of us when it comes to the budget times and when it comes to things we need, like making us a health science center.
Why do you think that was the right time for that initiative to go through? Do you think that was the best time, or could you move a little sooner?
I don't know if it was, we've talked about this for a number of years, and in fact, the plaque that first went on the building that was built in 1978 said North Texas State University Health Science Center, Texas College of Osteopathic Medicine. They've always felt that this should be a health science center. I don't know that, I think the timing was right in that we went to just ask Gibb Lewis to do it there. I don't think had Gibb decided to stay for 2 more terms, we may not have done it yet. But we thought we'd give him that option. And it was a last-minute deal. The governor called a special session in for public education, and we got the bill drafted and asked him to carry it, and he did. And then once we lost it by 1 vote, had we not come back and passed it, there would have been a lot of people thinking there was a reason for that. So, it was imperative that we come back now, or else there have been questions as to why we hadn't, and perhaps thought about hidden agendas somewhere, of which there weren't any.
So if we'd waited too much past that, say another year or so, it might have been different.
It may have been different. A lot of the members, there wasn't that large of a turnover in the House or the Senate between that the special session and when the regular session started, because the new terms took effect by that time. So a lot of people had been familiar with the issue and remembered that they'd voted on it. And if you voted for it once in November, what's the difference of voting on it once in March or February or April, as the case may be. So, but it was important that we do it now, because otherwise, with a big turnover, you got to go back and re-educate everyone as to the need and why this institution felt it was important.
At that time, were there some, why do you think it was necessary for the growth and success of TCOM to become a health science center? Did you have to push a lot of that with legislators?
We have internal reasons for it and we had external reasons for it. Externally, and one of the things that the Texas College of Osteopathic Medicine has always faced is that, especially in our basic science area, the osteopathic profession has never been that strong in research areas. Most of the other osteopathic schools, and a lot of them especially, you have to understand the osteopathic profession was private schools until the late 70s. So in a private school, without the need or without the desire to increase your federal funding, and without the need to impress your state appropriation dollars are being used to match up with federal appropriation dollars, there wasn't a big need in the private schools for them to do a lot of research. They were trying to educate students and graduate good doctors. As state schools began to come online in the 70s with Michigan and ourselves, Oklahoma, there started to be a stronger emphasis in research, but in all honesty, there wasn't that great an effort. I remember when I came here, our research was less than $1 million a year in federal funds. Now, 10 years later, it's close to almost $20 million. And we understood that to be an academic health center or to be a strong medical school takes a strong basic science component. And one of the problems I think some of our basic science had was when they sent in their applications and when they sent in their research programs to NIH or to various foundations or private research labs, the name osteopathic didn't really tell what we really were. The name Texas College of Osteopathic Medicine didn't show that we'd had a 20-year relationship with the University of North Texas, that a lot of our basic scientists have joint programs, that we have a lot of research people that are getting their PhDs and masters from North Texas who are working in our labs here on research projects, but are not, that doesn't show through a title and a name unless somebody happened to know. And that was one of the areas we stressed. Internally, as an institution, we knew we needed to do something to increase our bottom line and increase the number of students we have. The state's been very good to this institution and over the past few years, and the problem that we have is how much is enough to graduate 400 doctors. Our budget, when I came, our budget was about $19 million a year. It's now almost $27 million. That's $8 million a year, $16 million over a biennium that we receive in additional funds, and we're not teaching any more students than we had when we had 19 million. The question is, how much is enough? And I think we were coming up to where we were getting up. Our cost per student was high because we couldn't shift some of those funds like the other health science centers do. For example, if we have a nursing program or a pharmacy program or an allied health program, we're still only going to need one library. We may need more books in that library, but we're still only going to need one library. We're still only going to need one library director. We're still only going to need one president. Well, those are things that if we add another 100 students in an allied health program and bring in, like right now, we've got 75 in our master's and PhD level classes. Part of the cost of the presidency, part of the cost of the library, part of the cost of the physical plant, part of my salary can be showed that we are also doing things for those individuals, and therefore the cost per student for our institution is not as high. we had to do something that would do that, and making us a health science center and allowing us to add those programs was beneficial.
You had mentioned that 31% of our students go into towns that have 25,000 people or less.
Mm-hmm.
Were there some other things that you could mention to the legislature and to other people that makes this health science center have a different idea than Texas Tech or the others?
Sure. I think first of all, you have to talk about our primary care. We lead the state in the number of our physicians that go out and start residencies and practice in primary care. We lead the state when it comes to almost 1/3 of our graduates this last year went into family practice, which is unheard of in medical schools in Texas or the nation. We continue to go to that 31% of physicians in towns of less than 25,000. But just as importantly, of that 31%, 14% of those practice in towns of less than 5,000.
Oh my.
So we've got a lot of small areas out there, and physicians are community leaders no matter where they are. They're people that you take your kids to when they're sick, and they're involved in the Rotaries, and they often are out on the sidelines coaching the football. So a lot of those senators that travel through those areas for re-election and for other purposes, one of the people they like to meet is their physician, and that really helps and benefits because a lot of them know that our graduates are out there.
So the physician's also a community leader, and then the senator comes through and meets that person.
There has been many times in the times that I've been in Austin that we have benefited because either some of our graduates or some DOs in the community that care about our institutions have worked with legislators over various issues and take care of them in some instances, and that has been beneficial to our institution, unlike the other medical schools, because with 7 MD schools, if you've got an MD in your community, you don't necessarily thank one institution. Mm-hmm. If you've got a DO in your community, you thank the College of Osteopathic Medicine. We've benefited that way. We benefit as well with the osteopathic PAC that supports a number of candidates that we get credit because we're the College of Osteopathic Medicine.
What are some of the next legislative steps, perhaps, that you're thinking about for the Health Science Center?
Well, I think there are a number of issues that the institution is looking at. One, we're looking at a College of Public Health or a School of Public Health. We're looking at a School of Public Health that deals more in the preventive and public health care that has been important and a hallmark in the primary care areas of this institution. We're looking, we've had some people from the pharmacists come and ask us about a pharmacy school here, and these are not people we've solicited, but have come to us. We've had there's a school of podiatry that's been established but never funded in Texas. They were interested in seeing if we wanted it here. I think probably you'll see a tremendous increase in our basic science area with the PhD and master level students. I think if some of our contracts that we hope work out with the prison system and some of the needs that they have, as well as the Medical Education Consortium that we're a member of here in Tarrant County, you may see some physician assistants, some nurse practitioner programs, maybe in conjunction with somebody else where they grant the degree, but perhaps they do a lot of training in our areas. I don't know all the things that are possible. I think this next legislative session, we're going to probably go in and ask for some increased funding for some faculty so we can increase our residency programs. I think we're going to try to fund some more residency programs, like in Corpus Christi. We're going from 7 residents at a program down there to 21. We need to fund that program. We've got a strong need to establish some new rural health initiatives. We've not been funded federally for an AHEC program. Perhaps there's some things, and that's an area health education program where we put a physician out and then extend in the community where they don't have any physicians. If the feds continue to cut back in that program, perhaps there are some things the state can do that would help us continue to make a rural healthcare practice attractive to our students.
So you're really trying to bring the students out into the rural area then?
Well, that's one of the things that has benefited our college. I mean, a lot of the things that the state has tried to mandate medical schools do to increase the number of generalist physicians and to increase the number of rural physicians are things that our college has always done. We always had a third-year clerkship where our students went and learned what it's like to be in a general family practice. We've always had a clinic in Godley. We had a clinic in Justin that we closed, but we've always had a rural clinic so they can see what it's like to practice in a rural area. Part of the problem in medical schools that are sitting next to a major teaching hospital is that they don't know that they can practice medicine without all the bells and whistles, without MRIs and without CAT scans. Those are needed, but if you go to practice in Rising Star, Texas, you're not going to have that. But a practice in Rising Star, Texas can be very thrilling and very beneficial to you as an individual. And one of the ways of doing that, we have a lot of rural preceptorships where we send people to Eden, Texas, and Rising Star, and Ballinger, and Muleshoe, where some of our graduates are, and they find out that they can practice out there and have a good life, and that perhaps that's better in raising a family than some of the other things that they have as an option in the large community.
So we're definitely keeping a lot of our same focus that we've always had and working with what we know is work then.
That's correct.
What other challenges do you see that lie ahead for this Health Science Center and you as well?
I think as an institution, as a state institution, our challenges are always going to be funding. We've got a lot of ideas and a lot of things that probably could be beneficial to the state, but so do a lot of other people. And the dollars in Texas have tightened up considerably, and we're about to run out of accounting measures and accounting tricks to balance the budget in Austin. We've done it for the last 4 sessions that I'm aware of as we've tried to go through and get funding. We've never had a surplus. Since 1981 was the last year the state of Texas had a surplus in its budget. Because of that, it's always tight. I would say this next year the estimates going out we will again be $6 billion in the red. So they've got to come up with the ways of that's $6 billion if everyone continued and you took in the new mandates that the federal government sends. So in Texas we have a balanced budget amendment, and they've got to come up with that money, or they've got to cut for it to get to it. That $6 billion doesn't include any increases for us. Doesn't include any of those possibilities I spoke of before. It doesn't include pay raises for state employees, which have gone a number of years without a significant increase. There are a lot of state employees that earn less now than they did when they started 10 years ago. I don't know how long good employees are going to stay with that. Health insurance is another problem. We as a state institution belong to the state insurance plan. I'm sure those rates will go up, and if there's not a corresponding dollar amount to you, that's an additional pay cut. So we're very aware, from the president on down at this institution, the problems a lot of our employees are going through as far as financially, that the state hadn't taken care of that, and I think all state institutions in higher education are aware of that, and they're going to try to do something about that as well.
So there's always a chance they could cut some of the budget rather than give us some more money then.
There's always that chance. And in fact, what they traditionally do is give you maybe a flat budget and then take it away in the end. Say we're supposed to save X amount of money, and if you don't, we can come back in and reduce your budget. So we've been fortunate each year that there's been a slight increase or sometimes larger increases. we've never had a true major budget cut, and I'm hopeful that that won't happen again this time. Higher education has a lot of support in the legislature. They understand the need for it. Medical schools have support as well, and we have the strong support of the Tarrant County delegation that I'm sure is going to try to make sure that their institution in their area gets their fair share as well.
There's a lot of state institutions, too, to spread the money around in, it looks like to me.
That's right. We spent a lot of money. The legislature spent an enormous amount of money in South Texas last year at the expense of some institutions in North Texas and West Texas and East Texas. They felt that that was important to do that to get South Texas back on track as far as where their programs are in comparison to the other areas of the state or the regions of the state. But it doesn't hurt that that's a large Democratic turnout for the next re-election of the governor and lieutenant governor who are up for re-election this time, and I'm sure that had something to do with it as well.
I have to take in those political considerations a lot, I guess.
You bet. There isn't any question that there are times in Tarrant County or at our sister institution in Denton, when you have members that are elected that represent the areas your school is, that don't believe that any new taxes are needed or that don't support the budget programs, there are times that there are penalties taken out on those institutions.
I'm curious, now that we have all these changes in place and we're making more changes, how do you see your role in governmental affairs changing?
I don't know that it will truly change as much. I think it'll take more time to explain the need for more programs. It'll take the additional time of, I'm not an expert in anything, so it will take a lot more time of other individuals that are at this campus to go to Austin or go to Washington and try to explain why they feel that our institution is the best one possible to serve that need, and that's why it needs to be funded. We do take a lot of people to Austin during the legislative sessions to do testimony and to meet with different committees offering their expertise everywhere from funding from the Attorney General's Child Support Division, which funds our paternity lab, to our fiscal people that can talk about what we do with our budget, to people that have special items that like in computing some of our needs and how to explain those things. I think the same would hold true as if we look at any additional programs or new programs, that those individuals will have to go to Austin or to Washington, depending on where the funding may be from, to deal with that issue.
So it's going to take more than just you going back and forth. It's going to take a crew of people.
You bet.
Well, Mr. Jensen, we've covered a lot of ground here this morning. Are there some other areas that you'd like to bring up that I haven't mentioned, or any final remarks you'd like to make in regards to what we've discussed this morning?
No, I think the future's bright. I think we did the right thing in making us a health science center. I think with the leadership that's currently here at the institution, it'll continue to go in the right direction, never losing sight of what I hope continues to be our primary care mission. I think that's where our biggest problems may be. If we decide to try to do all things for everyone, that's not what we're supposed to do. I'm reminded, and I don't remember who said it, but somebody's job is the president. Oh, Lee Iacocca, when he took over Chrysler, he said the main thing is to keep the main thing the main thing. If we can continue to keep our main thing the main thing, I think the future's bright for this institution.
Mr. Jensen, thanks again for taking time out of your busy schedule to meet with us. I know that we've tried on several occasions to get with you, and your schedule's busy, and I see why after today, and I hope that you'll continue to keep working as hard as you have for the school. I know that everyone in the school appreciates what you've done. We could not have done a lot of these things without your help, and the school owes you a lot for that.
Thanks. Maybe I can take a tape of this to my budget hearings.
I'm sure that could be arranged. That's probably coming up. Thanks again, and we appreciate you taking time out of your schedule. And have a nice day.
Thank you, Blake.